Hi, everybody. It's Bob Crumb, CEO at Schoolcraft Memorial Hospital. This is our community update. A little bit unusual this time because we're in the midst of the pandemic, and we still want to get the information out to you. I want to introduce Ryan Pairolero. He's a big part of our Moving Forward expansion project. Go ahead, Ryan.
Hi, everyone. My name is Ryan Pairolero, Rehab Services Manager here at Schoolcraft Memorial Hospital. Happy to be here this afternoon, Bob.
Thanks, Ryan. Let's go ahead and get started. Next slide. I want to talk about a few things today. Giving Tuesday, which is tomorrow, Festival of Trees, and our building project, probably the biggest thing I want to talk about. But the Festival of Trees is, we're in the midst of it. All of the funds will go towards the infusion center and, will go towards rehab. And we're very excited this year. We've got more trees and wreaths than ever before. Please go online and look at the videos and the pictures. It's just beautiful. Buy your tickets, get them in this week so we can have our drawing. We're just very excited about the Festival of Trees. Go ahead, Ryan. This is an overview of what the new building will look like. You can see the main entrance. Then there's a bump out in front of it. That's the infusion center. And then the large building on your left is rehab. Off in the distance to the east, you see the admin building, but that profile has changed, and we'll go over that when we get to that slide. Go ahead, Ryan. All right, how did we come about paying for all this? The total cost is going to be $12.6 million. We have already set aside $2.6 million for net investment. $7.2 million is coming from a direct loan from the USDA Rural Development Grant and Loan. And M-Bank is providing $1.8 million in guaranteed loan. In addition, our capital campaign plans to raise $1 million through grants, foundations, and community donations, such as Giving Tuesday and the Festival of Trees. Next. So let's look at what the building's going to look like in the future. We looked at this view, but the future is bright, and we've already started in the back there with the parking lot and the pad for the admin building. That's going to save us about a month in the spring. We'll start in earnest in the spring, and we'll go from there. Very exciting times. Next slide. This is a view of the entrance to the new rehab facility, and it's got its own drop-off, as you can see, for physical therapy patients. Next slide. This is a different view of the west end of that building. Those windows, you're looking into the rehab gym, and it'll be brighter and larger. Those of you who have been to the current physical therapy will appreciate it. Next slide. The admin building is quite different than what you saw in that long range view. Next slide. As you can see, it'll be to the east of the building. The slants will capture some of the profile of the hospital, and this will house our home health, hospice, billing, HIM, IT, administrative offices. Just a lot of people going to be in here that are mostly scattered about or in the old medical office building. Next slide. So, as I said, there's infection control, utilization review, the trauma nurse will be in there, lots of non-clinical departments, and we'll have two new large conference rooms with updated audiovisual equipment for training and education. So we're very, very excited. This is a view looking back at the hospital. That's the clinic, back end of the rural health clinic that you see to the west. Next slide. The front entrance of the admin building. Next. The southern profile. Take advantage of a lot of natural light. So it should be really nice. Next is our outpatient care and infusion suites. That's a section that's growing. We thank our partnership with the Green Bay Oncology Group. We will be adding a sixth day after the first of the year. They're here 5 days a month as it is. But we do chemotherapy infusions, blood transfusions, antibiotic, hydration, medication infusions, and intramuscular injections. So they do a lot of stuff in that unit. I want you to take a look at this testimonial for a minute.
I would really encourage people to come to Schoolcraft for their infusion care, because my experience with it, I had to have chemotherapy, and it was so wonderful to have it in our local community.
The patients speak highly of the one-on-one care that they receive and how compassionate our nurses are.
I know we're a small hospital, but to get the care that you get, the personalized care and confidentiality and respect as an individual going through some challenging times in our lives, they were amazing. I would give them an A+. When you have to have chemo and you're going through the stress of medical things and you have to travel before and then after your treatments, it's just an additional burden, especially with the winters and the traveling and the traffic. And it gave my husband and I and our family so much more peace just knowing that I could be right in my local area. So it was very good, very helpful.
I think all the members of the oncology team are highly dedicated to what we're doing, and that we're a big team working together and giving excellent care.
The biggest thing that I was impressed with was if I had any questions or concerns, I could call, and it wasn't just the fellow RNs that would help and call back and assist in a prompt manner, but even the Green Bay oncologists, Dr. Ryan and Dr. Burnett, both during different situations during my treatments and stuff, would personally call me, and I was so impressed, and they helped me through that, and it was a very nice thing for our family.
The idea of Giving Tuesday is an excellent idea, and I couldn't think of a better project than helping with the infusion suite for our oncology patients.
I would encourage people in our community to please, if you can, I know it's tough times, but please, if you can, support the expansion of Schoolcraft Memorial's infusion and other services that we can provide. The care I received was amazing. So I was very impressed with Schoolcraft Memorial's infusion therapy and their ambulatory care, and I'm very grateful.
All right, there's no way I could say it better. So next slide. Green Bay has kicked us off, Green Bay Oncology, with a $2,500 donation. We believe we've raised another $2,500. Our goal is $10,000 for Giving Tuesday. So please help if you can. We appreciate it. This is what the interior of the infusion suites will look like. There'll be curtains around each one if you want privacy. There'll be lots of natural light. 2 private rooms across there you can just see the doors of. much better comfort, much better natural light and ambiance. There'll be a little waiting area for people who bring a guest, or just a place to move around. Rehab services. I'm going to turn this section over to Ryan because nobody can speak to this better. Ryan, go ahead.
Thanks, Bob. So hi, everyone. My name is Ryan Pairolero, Rehab Manager here at Schoolcraft Memorial. This is definitely an exciting time, not only for our rehab department, but for our whole organization here at Schoolcraft. So I'm going to kind of be going through the general layout of our new rehab building. So let's get jumping right into this. Obviously, Bob covered some of these slides already. I was just going to talk a little bit about some of the exterior views of the new building. As you can see, we have a lot of large windows in our new rehab center. Bob was absolutely correct. Our rehab gym is located right here in this corner of the rehab center. So it's going to allow for a lot of natural light to come in. It's going to allow patients to utilize exercise equipment and look outside and enjoy the day. We're just hoping to provide a great atmosphere when you come here for therapy services. Way over in the corner of the building in here will be our aquatic therapy pool, which will also have large windows for lighting. And we can get to that later on in the presentation. As you can see from this photo, we have a very nice entrance vestibule right here. There will be wheelchairs available for patients that need it. There will be a nice spacious drop-off area right in here. That'll allow patients that need to use a wheelchair, walker, crutches, or a cane, easy access to get into our facility. So this is the general layout of our rehab center. I'm going to kind of go through this in some detail now. Just so you know, this is just under 8,000 square feet, so it's a very, very large building. Currently, if I had to guess, Bob kind of talked about, what we're currently operating in, I would say is around 2,500 feet. So we're definitely grateful at the opportunity to deliver patient care in optimal conditions as this new rehab center will provide. So I'm just going to jump on right here and kind of go into more detail with some of the layout of our new rehab center. Bob, can you see this okay?
Yes, it looks great, Ryan.
Thanks. All right, so as you enter the entrance vestibule here, there will be several different doors to go through, and immediately on your left-hand side will be registration, which will be our rehab receptionists. You are going to be able to schedule your appointments right here and have a seat and wait in our waiting area, which will be located right in here. If you look right above the waiting area down this hallway was going to be 2 public restrooms for patients and staff to utilize. Through this door right here will take us into the main gym area. So this main gym area is going to be right around 1,700 square feet. As you can see, there is a bunch of exercise equipment right on this south wall that's going to be kind of right in front of the windows. So you're going to be able to exercise and look outside and enjoy the day. There's going to be 2 treadmills, an Aerodyne bike, recumbent bike, several new steps, an arm ergometer, 2 ellipticals, and an art trainer. There's also going to be a relatively large agility space right in here, measuring about 15 by 15 feet. So some patients that need to work just on walking skills can utilize that space, or higher level athletes can even use this space for agility type exercises. There's going to be a total gym along with a cable column, parallel bars, and a large mat table located in the center of our rehab gym. The nice thing is this mat table, we kind of put it there in case patients aren't moving very well and need to have somewhere to sit down or to utilize a large treatment space table. We're also going to have stairs in this corner of the rehab gym in case we need to work on stair training with patients, and that's something we do a lot, actually. One nice thing about our rehab design is we're going to have 3 treatment rooms that are very large. I believe they're right around 136 square feet attached to our rehab gym. So you're going to be able to access these 3 rooms right through here. And the other 3 rooms we have available are going to be accessed through this back hallway. And these are all relatively the same size. We do have 1 extra large treatment room to accommodate any sort of patient population that might need more space, with a half mat table in this room. As you can see here, we have a therapist workroom. This will accommodate 10 therapists, whether that be speech, physical, or occupational therapists. Let me just zoom out here. So this is the really exciting thing for our new rehab center is aquatic therapy. So we are going to be having aquatic therapy pool. But before I dive into the pool, I just wanted to show you a little bit of how patients will access the pool and where they can change and things like that. So right in here is going to be the pool entry. So a lot of patients will come into this doorway right here. There will be a set of lockers where they'll be able to drop off their items, such as their coat, their shoes, their purse, and things like that, and then take whatever they need to change into and go right in here and change, and then enter into the pool right through this doorway here. We should be able to accommodate 1 to 3 patients at a time. So if there is ever an instance where a patient enters this pool entry and someone is utilizing this changing room, they'll always be able to come right around and access this shower toilet changing room. So let's dive into our therapy pool. I'm just going to kind of zoom in here. So our therapy pool is a 12 by 18 foot pool. It has 3 different depths. If you've ever gone to a hotel, you notice that their pools kind of gradually go down in depth. A therapy pool doesn't really do that. So what we're going to have is more of tiered type depths. So we're going to have our main entrance to the pool is going to be right here, and this will be by stairs. If certain patients can't access the pool by stairs, we will have a chairlift for them to utilize. When they immediately get into the pool, this depth will be 3.5 feet deep. There will be a 3-foot bench right over in here in case patients get tired or need a break, they can sit down and take a rest. As you can see with this little dotted line right in here, this is going to be a drop off where it actually goes down to a depth of 5 feet. And then there will be another dotted line here that will be a drop off into 6 feet. This little area right here is actually going to be a slight partition wall that will allow patients to sit down or exercise in this 3.5 feet without feeling unsafe, like they're going to fall into that 6-foot depth. Some nice features of the therapy pool is that there's going to be handrails all the way around the perimeter of the pool. So if patients need to hold on to a handrail, there should always be one relatively within reach for them. There's going to be 1 jet in the pool, which will allow us to provide some resistance for patients as they need it. But there's a lot of benefits that aquatic therapy can provide to different patient populations. And that's something that we're really excited about here at Schoolcraft Memorial. Things like patients suffering from chronic pain, or patients after having a surgery, patients suffering from joint pain, if they're having balance problems, if they have abnormalities of how they walk, we can help with that in the pool. And certain neurological conditions such as stroke, Parkinson's, and multiple sclerosis all can be beneficial with the use of aquatic therapy. So aquatics really provides opportunities for movement a patient may be otherwise unable to perform. So what we find in times is that some patients don't tolerate what we call traditional land-based therapy, and putting them in this type of environment really optimizes their chance of making progress and getting better. So what is it about aquatic therapy that makes it so beneficial? Where there are just a couple things. The pool is going to be regulated at 88 to 95 degrees. So it's going to be much, much warmer than a standard pool you'd see at maybe Manistee High School. That's much at a lower temperature. Buoyancy of water, as we know, if you put a 5-pound weight on the bottom of a lake, it doesn't weigh 5 pounds anymore. So this allows people to exercise under less of a load. And that's one of the main benefits of aquatic therapy. So we're really excited about these new services we're going to be able to provide to members of our community and to our region. So with that being said, I gave you a general rundown of kind of the pool. We have also over here an OT, which is occupational therapy treatment room, along with a speech therapy room down this back hallway toward the main waiting area. So with that being said, I'm not going to cover too much of the intricate details along the lines of staff break rooms and cleaning supplies and that type of thing. But that's just the basics of our new rehab gym.
Boy, Ryan, that's really exciting. It's great to see. What's next?
I'm just switching over here, Bob. 1 second.
All right.
So I just wanted to stop. These are some of the common conditions and benefits of aquatic therapy that I kind of highlighted before in case anyone wants to take a look at that slide. This is just kind of a 3D rendition of the new therapy pool. This would kind of be the northwest corner of the aquatic therapy pool. There's going to be a lot of windows around here. One nice thing I think I want to highlight is, you know, we want to definitely protect patient privacy and modesty. So the first 4 or 5 feet of that window space will actually allow light to come in, but it won't allow anyone to see into the aquatic therapy pool area. So we've kind of thought about all the different intricate details of this project, and it's coming together really nicely. So, and I will turn it over to you, Bob.
Thanks, Ryan. Great job. The Allenot Rural Health Clinic is going to expand significantly, about 8,500 square feet. That's going to allow us to redesign our space into what the providers have called pods. And right now, if you've been into the rural health clinic, there's what we call nurses' row. There's a big long corridor of nurses, and then doctors' offices around the outside, and then their exam rooms scattered throughout. What the new design is going to do is to put a doctor, their nurse, in the exam rooms that they have access to right together. So thus the idea of a pod. We think this will allow for more efficiency, better care, staying on time, perhaps being able to see more patients. So we're very excited about that opportunity. We'll continue with our patient-centered medical home designation. And as many of you to the east know, our Nobbinway Clinic has really grown, and we're going to begin specialty rotations through that facility next year. Next slide. Here's a list of our specialty physicians. Pretty impressive for a little hospital. 1.5 orthopedic surgeons, a general surgeon, a surgical podiatrist, a full-time cardiologist, a full-time otolaryngologist, which is ear, nose, and throat, physical medicine and rehab. We have wound specialists, psychiatric nurse practitioners. We have a number of visiting specialists also with obstetrics, oncology, cardiology, interventional cardiology or radiology, vein and pain clinics. neurosurgery, urology, ophthalmology, pediatrics. So just a full breadth of services so you don't have to travel, so you can stay here. We appreciate you considering us. Next slide. The Nobbinway Clinic, which I touched on, is a full rural health clinic. As you can see, they provide a breadth of services, including commercial driver's license, physical exams, and they take walk-ins. So anybody at any time can be seen. We've got a great team there in Dr. Balmer and Tracy Marino. Just a great operation there. Next slide. Also, our behavioral health clinic has moved into the old Wilson building, if you will, and on Walnut Street. So the whole team is over there now. We've added Julie Hardy as a therapist, and Rose Pan as the patient navigator. We're using Community Connect to begin to use that service to provide community partnerships to help patients, whether it's their behavioral health, whether it's substance use disorder, or just plain health. Help. That's hard to say. But Rose can connect you whether you need help with food, whether you need help with heating. All of these things are available because those all play a role in your health. Next slide. I want to talk about some of the new technology we've added in the last year. We now have state-of-the-art nuclear medicine equipment. This is SPECT CT camera. You can kind of see what the SPECT camera used to do, what a CT can do, and then what the two combined, which is the unit we have, can do. And you can see down here in the lower left the detailed, specific views that our physicians can receive now. Much lower radiation, very shorter time to complete studies. So very exciting piece of new equipment in imaging. Next slide. We also added a CT, new 64 slice CT with a wider bore, a larger weight limit, 50% reduction in the dose required, which allows for faster scan times, and a number of new interventional tools that have allowed our physicians to really enjoy the next level of imaging. Next. We also are partnered with Upper Peninsula Healthcare Solutions for our mobile MRI. We just brought online this past year a wide bore, which means it's a much larger diameter, makes it more comfortable, less claustrophobic. It has some noise reduction. We also have built-in sound system. So this is a really great imaging tool. They're here 2 days a week, Mondays and Thursdays, and this has provided just a tremendous improvement in our ability to provide MRI imaging. Next. Next slide.
I think that's it, Bob.
Oh my. Well, I just want to remind you, Giving Tuesday is tomorrow. All the funds donated will go to the Infusion Center. Festival of Trees goes on the rest of this week, and the monies there go to the Rehab Center and help Ryan's dreams come true. And I thank you all for choosing Schoolcraft Memorial Hospital. We know you have a choice, and we're glad you choose us. Thank you.